So let me say a few remarks about Manoj. Manoj is founder of Social Alpha, a multi-stage innovation curation and venture development platform for science and technology in Bangalore, India, and Delhi, India. Social Alpha supports entrepreneurs through a network of innovation labs, venture accelerators, blended capital pools, and market access. Before founding Social Alpha, Manoj was an entrepreneur himself. He serves on the boards of several companies, not-for-profits, and research institutions. He's also a trustee of the Tata Institute for Genetics and Society and a senior advisor to Tata Trusts. And many of you would be aware of the Tata Cornell Institute. My own exposure to kind of finance and venture capital and ag tech was a kind of market-centered, business-centered, I would call it red meat capitalist-centered view of the world, and that we can solve our social problems by doubling down on capitalism as we know it. But I think Manoj is built different, and I guess we're going to see. So thanks for being here. I appreciate it.
Thank you. Am I audible? Yeah. Thanks for inviting me. And it's always fun to be at the, academic institutions with students and faculty members, more so with the students. And especially after you have left academia, you have these cravings to get back and talk and see what you can learn new. So happy to be here. This is my first visit to Cornell, so I'm also very excited about it. Yeah, perfect. So the point I'm going to make today in this short 30 minutes conversation is that how do you solve social, economic, environmental problems when the market fails and state is suboptimal? Who does? Who takes the leadership? Who starts taking innovations to communities and start solving problems? Because we are always waiting for either state or the market to solve those problems. Let me take one example. I was reading this Sustainable Development Goals report that came few weeks back, 2023 report, which has actually changed the numbers that, in fact, I was using in my slide, that 381 million people have been pushed into extreme poverty because of out-of-pocket expenses in healthcare. 381 million people globally. One of the major reason is cost of diagnostics. We have the best of the science and technology innovations and institutions around the world, but we cannot provide screening devices, diagnostics tools to either frontline healthcare workers or doctors or public health system to provide healthcare which is affordable and accessible to everybody. Millions of people do not have access. There are many ways of improving access. One is innovation. Can we reduce the cost of diagnostics and make it more affordable so that public, private, non-profit, all healthcare providers can reach out to a larger population? This is an example of innovation. It's a 1.5 Tesla MRI machine. It's the first liquid helium-free, non-cryogenic MRI machine ever built, and it has not been built in companies like GE, Philips, and Siemens, who are the market leader. It has been built by a group of 7 engineers sitting in a small room in Bangalore, in India, with a budget of $12 million over 7 years, for which a large MNC would have spent $200 million over 10 years. It took 7 years to get from lab to regulatory approvals, clinical trials, and it's getting into the market now. It is half the price of any comparable 1.5 Tesla MRI machine. It's non-cryogenic, it's portable. You can put it on a truck, take it anywhere in a primary health center situation, do an MRI scan there, transmit it to a central facility of radiologists who can do the interpretation. By the way, the imaging is also 3 to 4 times better than the comparable MRI machine of any large corporation. So this innovation makes MRI scan affordable and also accessible by making it portable, lightweight, and the operating cost is less because it doesn't use cryogenic cooling anymore. But this impact on healthcare delivery is not against the economics, because there are more than 6,000 MRI installations in the United States itself, where their annual operating cost would be higher than the capital expenditure on this. And you have several low and middle income countries where MRI scans do not happen. So you have created new markets. If you solve a problem that solves for a large population and also creates the market, you can attract mainstream investors. So after 7 years of bootstrapping and philanthropic capital, this company last year raised mainstream capital of $5 million at a $30 million valuation, which is nothing compared to the valuations that you see in developed market. But the point is that you have de-risked this innovation not only to go to market and go to communities, but also attract mainstream investors who otherwise are not interested in investing in this space. Let's take another example. It's very relevant in today's context, where our newspapers and media channels are full of climate change and global warming narratives. India and China do not really emit much. And India is going to be the biggest emitter over the next 50 years. Our energy consumption will increase because we have just started using energy. We will buy cars, we will build roads, we will consume more energy, and people have aspiration to improve their quality of life. So energy consumption probably will increase by 400% over the next 50 years. And energy is one of the biggest emitter of greenhouse gases in the sector. And everybody around the world, when talking about net zero and energy transition, what does it mean for the global south? Energy transition and net zero could be a global desire for the developed world, but there are 150 million smallholder farmers in India itself. They don't care about it. They have not even consumed energy. I cannot go to a small farmer in a state in India, say Odisha, and who has 2 cows and makes less than $200 a month, and tell that farmer that, look, you have 2 cows and methane emission from your cows is causing global warming and climate change, and therefore you need to stop dairy. I cannot. There are 65 million small and medium enterprise who run on diesel gensets and have extremely inefficient manufacturing processes, have no working capital access, their personal wealth and their business are all in one, merged together. They are already struggling. Their margins are very low. They are just surviving and sustaining. And some policy in some European Union would say that we would stop importing from manufacturers who have carbon footprint. Therefore, all these 65 million MSMEs over a period of time under certain global treaties and agreements should go to net zero. What does it mean? Who is going to pay for net zero? Who is going to pay for transition from fossil fuel economy to clean economy? It costs a lot. And who is going to be paying for the working capital and capital expenditure and changing the energy efficiency of the production process. I'll give you another example. Post-harvest food loss is a big problem everywhere in the world. And I picked up specifically because I'm talking in agriculture school. Unreliable power, grid is unreliable. People run gensets half of the time. Large number of people at the farm gate who produce vegetables and fruits do not have any way of extending the shelf life of their produce. This is an innovation. It's refrigeration at farm gate. It's powered by biomass, which is plentifully available in India, Africa, and other countries. It's compression free, zero emission, low cost, 40% lower cost, operating cost. Similar innovations are required in off-grid refrigeration, to cooling, to heating, to thermal comfort. Every year, more than 10 million tons of flower waste from places of religious worship are dumped into river bodies. And since these flowers are produced industrially, they contain traces of different chemicals, and these chemicals seep into water bodies as well as soil. It's a monumental waste problem. You need innovation in converting this waste to value. And here's a company that has converted in using biotechnology into a leather replacement, which is biodegradable and a consumer product. So all three, the healthcare diagnostics device, the off-grid cold storage solution, or new biomaterial. These are the companies who could never raise money from any investor. No impact investor, no mainstream investor. Nobody funds this. So even if there are innovators who are trying to solve some of the complex problems in climate change or healthcare or livelihoods, they need an ecosystem to support them. They need access to capital. They need access to infrastructure. They need access to entrepreneurial mentoring. And they need access to someone who can create opportunities for new market development. Was there a market for MRI scan before this machine was built? Theoretically, yes. But at a price point, the market just expands. Fool, by creating new products, has suddenly created a new market for alternative consumer products. The point I'm trying to make by giving these three examples to you, and there are more than 75 examples we have in our portfolio, that global development needs more innovation. We need innovation in energy access. We need innovation in energy consumption. We need innovation in new material that would replace existing material in our work. We need innovation in healthcare, diagnostic devices, screening device. Think of a frontline health worker who can actually use a screening device and refer a patient to a secondary or tertiary care much faster and save lives. But those screening devices don't exist. So today, a person in a village goes to an urban center where you have medical facilities available, loses a day or 2 days of income because that is the time you spend on traveling and getting checked, and getting primary or first screen report at the secondary or tertiary center. Task shifting can happen from doctors to frontline health workers using innovation. So increasingly, innovation in these areas of whether it's agriculture, livestock, healthcare, assistive technologies for people with disability, climate change, mitigation as well as adaptation, you need more innovation. But innovation is not sufficient. You also need entrepreneurs who can take that innovation from lab to market and deploy for the community. But that is where the problem is. Because if you look at the R&D ecosystem, which is usually in the academic institutions, research institutions. That is where innovation originates. And where it is deployed and scaled up, that's closer to the market and communities. And the gap between that is not visible in mainstream economy. So assume a new innovation in this campus is relevant for a corporation, there would be technology transfer, and the corporation's R&D would convert it into a product or a solution and take it to the market. But who is innovating for poor? Who is innovating for the planet? Who is the venture capital for planet? Who is providing infrastructure and ecosystem and mentoring for innovators who are solving problems in primary healthcare in global south? So that gap is huge. And because of lack of capital and lack of support, people do not venture into these areas. People believe that there is a potential market creation opportunity, but they don't venture because you don't have enough capital or enough support. If you start a company today in edtech, fintech, or digital consumer space, you have plenty of venture capital. If you have an idea, you can execute, you will raise capital. Not in this sector, not in agriculture, not in water resource management, not in soil regeneration, not in mental health. And therefore, this ecosystem needs to be built. And let me get back to a completely different narrative that exists about capital is available for business if you have an innovation, an idea. The problem is capital is not available when the risk is very high. And when you are solving problems in sectors like climate and health, you are taking extremely high level of risk because there are no proxies and no data or no entrepreneurial activity that can tell you what kind of investment is required and what is the risk adjusted return expectation on that investment. If you draw a graph between perceived venture risk and the potential financial return, the mainstream capital pools work very well between public markets and private markets, right? If you don't want to take much risk, you can invest in bank deposits and public markets. You want to take very high risk, you can invest in venture capital. You want to take even higher risk, you can gamble with your money in derivatives market. So depending upon your risk appetite, you can take an investment decision, and that's how the mainstream markets work. But the development sector, the area where your climate change, healthcare, livelihoods fall, the perceived risk is very high because there is no evidence of market creation there. And therefore, venture capital doesn't get into that. They don't understand the risk. And therefore, you need to create a new category of capital to fund these startups. And it could be a blended pool of capital. It could be a pool that has philanthropic capital, public finance, and market capital all aggregated in one. And depending upon what is the state of a startup, what is the state of an innovation, what is the risk assessment you have, depending upon all these parameters, you can deploy capital in different ways. Therefore, the mainstream investment model, which is very linear, low risk, low return, high risk, high return, which has been taught in every finance 101 class, doesn't work here because the risk reward equation has not been understood and has not been applied at scale. And therefore, we built a 3-tier architecture, a full stack architecture, right from integrating with the R&D ecosystem, which we call Social Alpha Labs, where our innovators can build their companies, which is more like your incubation centers in the academic institutions. So Social Alpha Labs work very closely with the incubation centers across the country, searching for curating innovations, searching for innovators who are willing to work in this sector. The Social Alpha Ventures actually allocates capital in different forms to these startups, and Social Alpha Community is the deployment side where you work with the community organizations or societies, NGOs, individuals on the demand side. Work with these organizations in generating the demand, pilot new technologies, create evidence, and then get the innovators and the communities together. And that is how you create markets. So this whole transition from lab to market to communities requires a full stack architecture. It doesn't happen, and we don't intuitively think about it in mainstream world because everything is given, right? You can buy furniture off the shelf, you can get transporter. So every service provider in the mainstream world is present, right? A car manufacturer does not have to think about how am I going to source tires and steerings and where am I going to get to the gas station. The ecosystem is well developed. You just need to think about your core competence, build your product, build your solution, take it to market, because you can assume that rest of the ecosystem will orchestrate along with you because everybody's interest and everybody's incentive is aligned. Capitalism has made sure that every player knows what their interest and incentives are, and their incentives are aligned, and people will work with each other, collaborate with each other, partner with each other as long as their incentives are aligned. But how do you align incentives in development? How do you align the incentives of market, community, and state? State is the custodian of public policy. Market provides capital for products and services. And the community is on the demand side who is facing the problem. We are talking about climate change, but people who are smallholder farmers are already facing the burden of climate change. The victims of climate change are small farmers, coastal communities, tribal populations. They are already facing it, right? Their incentive is right now in solving their problem. So if you have to align the incentives, you have to create a new model of capitalism, because the existing model of capitalism aligns incentives of software companies, hardware companies, automobile companies, aerospace companies, defense companies, pharma companies, not of climate tax, not of healthcare, not of assistive technologies, not of agriculture equipments and appliances for smallholder farmers who have less than 2 hectare land. And this experiment we have been doing since 2016, 7 years. And in 7 years, we have deployed more than $50 million. But you see, only $7 million has gone as equity investment in these companies, which effectively tells you that how much capital is required in curating innovation, taking it from lab to market, deploying it, demonstrating that the innovation works, creating demand for the community, and creating a scale-up playbook. So a lot of money is required to actually build and orchestrate the ecosystem inside which the small venture capital piece sits. The $7 million venture capital type of work that Social Alpha team does is actually subsidized significantly by that 12 million grant and 31 million market access. Is it new? Is it shocking? Is it unique? No. Mainstream world has taken advantage of this. Every vaccine company has been funded probably by DARPA or NSF or different funding agencies. All EV companies have been funded at some point of time through public money. So it's not that the early underwriting of risk does not happen in mainstream world. Mainstream business knows and understands how to leverage public money. Somebody built internet, then only internet economy was built, right? Somebody built road, somebody built the infrastructure, right? It's not that someone made app and suddenly the world got a revolutionary feeling about it. Someone funded internet for many, many years through taxpayers' money. So in the mainstream world, right, mRNA platform was built before we all came to know about modern financial success, right? So it's really important to understand that the risk underwriting for promoting innovations and entrepreneurship in social or development sector is not happening because public sector is very thinly distributed and a large number of public sector funding is going to mainstream business. Philanthropy is the option, but philanthropy needs to change. Historically, philanthropy has been used for charitable grant giving. And it should continue to, because you need money for disaster relief, you need money for charitable grant giving. But a portion of philanthropy has to be allocated or assigned for innovation, because innovation in development sector is deprived of capital, and that capital is required for a longer duration. The MRI machine example, 7 years from lab to regulatory approvals. You need single funding mechanism for that. You cannot have different organizations funding the journey of this MRI machine at different part of their life, because then it brings uncertainty to you whether I complete first milestone, whether I will get money for the next milestone. Milestone based funding with uncertainty of whether you will get it renewed or not does not give an innovator or an entrepreneur the confidence that he or she can take this to market. So you need an aggregated pool of capital, and that's what we are trying to do. We are trying to create an aggregated pool of capital where with flexibility we can do grants, we can do equity, we can do working capital, we can do market access support, we can leverage the larger ecosystem and eventually de-risk these companies and invite mainstream businesses and mainstream investors to invest in them. And that is what market creation is all about. So the summary is that incentive alignment that naturally happens in the business world has to be led in the development sector. The incentives of small and marginal farmers must be aligned with the incentives of agri-tech entrepreneurs, with the incentive of state government that is making policy for agriculture and rural development. The alignment of incentives is the only way all these people will come together, and somebody needs to take the lead. And we hope that philanthropy will take the lead, because the state resources are suboptimally, very thinly distributed. This aggregated philanthropic capital should be flexibly deployed in different financial instruments, not limited to grant, or not limited to equity, or not limited to debt, but a variety of financial instruments depending upon the stage of a startup, depending upon the complexity of the innovation, depending upon the problem that you are solving, and whether more capital or less capital would be available to that space. And what if you invest in equity? So for example, when I said $7 million has been invested in equity, which has a market value of $35 million today, what if tomorrow there is an exit? What do you do with that capital? You reinvest them and create a circularity of philanthropy, right? Aggregated pool of capital becomes a perpetual capital pool, and you keep innovating, keep investing in new innovation and take them to market, which effectively means that you would actually increase the supply of innovation to the development sector, and which is what you need in order to address the issues of inequity, concentration of wealth and power, that you need more and more innovation. An open free market that promotes more innovation will always check the inherent biases and problems of capitalism. And that's what we mean when we say reimagining capitalism, that you need to create a new pool of capital that is flexible enough to promote innovation, to take it from lab to market to communities, to de-risk it, and to integrate it with what we call mainstream. And that's why we built this platform called Social Alpha, which is focused on innovation only in areas where market failure is visible. If market takes over, we get out. Identify the areas of market failure, search for innovators, help them build a startup, help them get access to the market, get communities who are actual users access to these new innovations, and start economic activity. So social, economic, and environmental value can be created simultaneously, not either or, but simultaneously. And that's what the whole purpose of the organization. I think I managed to finish in 30 minutes, so happy to take more questions.
Thank you, Manoj. So I think that it's, for me, learning that this idea that innovation rests on infrastructure is a really important realization, that it's not just some bright man or woman with an idea and a couple friends and a garage, but it's much more structured and formal And it's a long process where you really need a network and an infrastructure to make it happen. So I think we have to recognize that. The next point that I would like to highlight is that Manoj doesn't just recognize a market failure. For him, it's an institutional failure. So it's both a problem of state resources, philanthropic resources, and market resources. So not just to blame kind of economic problems, but it's also public policy problems and social problems. And this idea that we need a new pot of money, which could be this blended capital, which comes from commercial investors of different kinds. It's not one kind of commercial investor. Public money, and that can be different kinds, and philanthropic money, I think is quite important. Recognize that the entrepreneurs call this valley of death, this idea that they have to get from A to B and have to attract capital, but they can't attract capital if they're basically producing public goods. There's no willingness to pay, or willingness to pay is weak. So then you have to make a different argument and to appeal to different investors and get those incentives aligned. And the last point, I guess, would be a critical point, would be, and I think Mildred has anticipated this, but the idea that we should financialize philanthropy, that I think could be an interesting conversation, that we're now going to create and turn the philanthropic sector into a kind of calculative engine for securing their future and their impact by picking winners that they're going to plow back into the next round. That I think we're going to get some pushback. Okay, yeah. So with that, some questions for Manoj. I'll let you field them, please. And I can pass the microphone around. I come here and I'll work with it.
Thank you very things. But then we're talking about invest in development processes and innovations. And I think philanthropic organizations are not yet ready for this. And how do you think we can get them to be interested? Then the last one is about, you seem like you have abdicated the role of the state to infuse development financing, because I do not think that development work could actually be made more innovative. I don't think many things could be achieved if the state does not play its role as a development facilitator. So we can have the market, we can have all these players, but I think we know from the stories of Tesla and all these big corporations that the government significantly gave them huge chunks of money to facilitate their innovation. So maybe some thoughts.
Great question. So what? You want me to answer, or shall I?
Some of these, and then we'll take another round.
Yeah. See, let me give you an example to explain the incentive alignment problem. We have 85% of our farmers are small and marginal farmers. Right? They have less than 2-hectare land. And if they use innovation, they can increase their productivity, reduce their risk, maybe reduce the drudgery also that is involved in agriculture. If I ask my agri-tech startups to come and work with these farmers, they would be reluctant because they would always think whether these farmers actually make the market and can pay. Right? But the question is, do you have a solution which you can demonstrate? Right? And if you have a solution that you can demonstrate, We use philanthropic capital to do a pilot or a demonstration with the farm community to show them how this innovation actually makes a difference in their life. And if that happens, and when does it happen? When people start believing in it. And when they believe in it, means one, they can afford it, they like it, the user experience is good, they have no problem in seeing the benefits. That is where they start liking it, right? There could be still a problem that the price point at which the innovator is selling product or service to the farmer is not something they can afford. There is a delta there. Can you solve it by getting in financial services providers to make it more affordable over a period of time? Or can you use this evidence and data from the ground and go to the government and say, look, in your constituency, we have these farmers who are interested in using this appliance or this technology, but there is a gap, and can you unlock subsidies? Right? That is where you start influencing public policy, but your public policy is not driven by activism. It is actually driven by evidence that is coming from implementation on the ground and endorsed by the community. Right? So data driven, evidence based, community driven, community endorsed policy advocacy that could unlock the subsidies. Right? Now what are you doing? You are aligning the incentives of policymakers, right, with the market, which is the innovator, the startup, and the community. And we have done this in one state with 3 success stories, and we are replicating another state now. Right? So it is possible, but demonstration is something you have to do. We cannot align incentives based on hypothesis or theory. It has to be bottoms up, market driven demonstration with the evidence. Then only people believe in it. You need to see. Farmer needs to see more money in the hand. Then only she is going to believe that this innovation works. Right? Not the promise. Promise doesn't work because they have been promised for years. They have been deprived of wealth, innovation, water, anything. People need evidence. Evidence is cash in hand, reduction in drudgery, reduction in risk, right? And that's what the state also needs. That's what the startup also needs. So then only you can align the insight. Yeah.
Make sure that we bring the Zoom audience into the seminar. And so I want to take this question here in the middle of the room.
Yeah.
And we'll ask if you have questions on this audience. Please.
Thanks for the presentation. I want to, you mentioned that I think it was that public money is very, although this is for a lot of places, I think that the US and then the EU and other developed markets, this might not be as true. A way for those countries to divert some of the money that they might get, for example, fossil fuels, and diverting it to those more philanthropic goals, and maybe with the same thought process which you mentioned, the EU doesn't want to afford net or
Got it.
imports from other countries with the same mindset.
Great question. In COP15, I think 2009, the developed world promised $100 billion a year commitment to the global south and developing world for climate action. That was, I think now OECD is monitoring this, and hopefully in 23 or 24, the $100 billion target probably will be met, right? It's very difficult. People have not really lived up to that promise, right? And see, who are the victims of climate change? People who never contributed to it, right? And they are not going to be doing anything. But if you have to create innovation that will help them in mitigation and adaptation both, that innovation probably has to be created closer to them. Look at the MRI machine example, $12 million over 7 years versus a $200 to $300 million innovation budget in a large multinational corporation, right? So public money, especially in low and middle income companies, is less and thinly distributed because they have to satisfy multiple constituencies owing to their size of population and geography. So the only option is that global philanthropy creates a pool of capital that then gets allocated to innovators and also for deployment, not just for innovation, but for deployment as well. That's the only option. Because right now, especially in climate, all negotiations are theoretical, driven by policy research, whether these are COP negotiations or these are, trade. Now, even the next round of trade negotiations, probably climate will take a front seat in that, right? So, what is going to happen ultimately, as you enforce on poor countries that they need to move out of fossil fuel or coal, where are these people going to work who are working in the coal mines? Who's going to think about that? Or if you stop importing from Bangladesh all the garments just because the climate footprint of those factories, right? I was reading somewhere some European policymakers saying that we have to discipline the polluting countries. Oh, of course, you discipline polluting countries by not killing their vulnerable population, right? Investing in innovation probably is a cheaper and better tool. We have probably spent more money in international conferences like COP and others than actually investing in innovation in the developing world. Yeah.
Can we take a question? So, get it right close. Get it close to your mouth.
Right. So one of the questions is, what is the starting point for social entrepreneurs in developing countries like Nigeria to help the government and multilateral donor systems recognize the infrastructure and continue funding to our development?
This question can be answered differently by different people, I'm sure. The starting point is always demonstrating that you understand what problem you are trying to solve, right? Whether it's your donor or policymaker or your friend in academia, everybody wants to first see whether you understand what problem. Are you just an intermediary or you understand the problem? Do you have a thesis around that problem, right? And then you can go to government, multilaterals, philanthropic institutions and explain them that this is the problem. This is my thesis around it. This is what has been done over the last 20 years. This is why this problem has not been solved. And these are, of course, 10 organizations who have tried to solve this problem in these ways. And this is how we are going to search for innovation, take it to market, deploy it at scale, and for which we need capital. Right? Asking for capital is the last point. Demonstrating the understanding of problem and potential solution landscape is the first point. Right? So that should be the narrative. That's what we do actually.
Great, thank you. This person is asking about the barrier to the development world in terms of marketing products and services. So, for example, their son works in startups developing diagnostic software for retinal diseases, and the startup markets the software in both developed and developing countries. So, given that examples of this are exploding, how can we improve more of this? Yeah.
Bridging the gap in taking a software solution to the market. Again, my answer is still the same. If you know what the problem is, then you know what the market size is, and then you know how to take it to the market, right? If you have only one product and you don't have your own sales and distribution channel, you work with others, partner with others who have the sales and distribution channel and use their sales and distribution channel, right? Yeah.
My question is, so your solutions for these challenges like the environment itself for the developing world is like innovate home ground, right? And you also pointed out how philanthropy needs to be redirected towards innovation. Instead of looking outward for that investment, what do you envision for India, for instance, to invest more in innovation through philanthropy? What's your vision for that through home generated funds?
In general, not only institutional philanthropy, even individuals, right? Even if you and I have to take a philanthropic decision, we want to give to see direct impact, right? If you give money for say shelter, right, or education, you get instant gratification, right? So we are human beings. Institutional memory is also similar. It takes a lot of time and effort, and if you see, not many philanthropists today fund innovation, right? And the assumption has been that okay, government is already doing it with the public money, but that's insufficient and very suboptimal, as I mentioned. So I'm not saying philanthropists should redirect everything to innovation. They should earmark a certain amount of capital for innovation, because innovation is so high risk that mainstream market will never do it. So-called impact investors invest in India, at least they invest Series C and beyond, right? So it is important that someone with a higher risk appetite is creating a pool of capital that is used. So in India also, like our first funder was Tata Trust, right? Next funder was JSW, right? So we have been able to raise money in India. We have also raised money in Europe and US.
So, I mean, do you see like a proper structure, like a building generating funds? Like I, as an individual, I would look for, there is Kickstarter, for instance, I would put some money in some of the innovations which attract.
Yeah. So
platforms.
yeah,
Do you see
so
those?
in the mainstream world, such platforms exist. You have VCs, you have angel investors, you have investment network. But in this space, again, in innovation space, such platforms do not exist. We are building one. We call it Alphabet, where we have about 250 partners for doing that.
So thanks. What's interesting is that Manoj's advice to the entrepreneur is great advice to students. If you're trying to write a thesis or a dissertation, it's a great idea to know look what other people have done and make a clear case. So I like it.
Thanks.
All right. So thanks to all.